Hello everybody. Welcome to Number 1 Doctor Channel. Today we will talk about puppet syndrome, as a part of our playlist called Medical Syndromes. Other names: Angelman syndrome. Angelman syndrome is a genetic disorder. It causes delayed development, problems with speech and balance, intellectual disability, and sometimes, seizures. People with Angelman syndrome often smile and laugh frequently, and have happy, excitable personalities. Developmental delays, which begin between about 6 and 12 months of age, are usually the first signs of Angelman syndrome. Seizures may begin between the ages of 2 and 3 years old. People with Angelman syndrome tend to live close to a normal lifespan, but the disorder can't be cured. Treatment focuses on managing medical, sleep and developmental issues. Symptoms: Angelman syndrome signs and symptoms include developmental delays, including no crawling or babbling at 6 to 12 months. Intellectual disability, no speech or minimal speech. Difficulty walking, moving or balancing well. Frequent smiling and laughter. Happy, excitable personality. Trouble going to sleep and staying asleep. People who have Angelman syndrome may also show the following features. Seizures, usually beginning between 2 and 3 years of age. Stiff or jerky movements. Small head size, with flatness in the back of the head. Tongue thrusting. Hair, skin and eyes that are light in color. Unusual behaviors, such as hand flapping and arms uplifted while walking. Sleep problems. Causes: Angelman syndrome is a genetic disorder. It's usually caused by problems with a gene located on chromosome 15 called the ubiquitin protein ligase E3A-UBE3A gene. A missing or defective gene. You receive your pairs of genes from your parents, one copy from your mother, maternal copy, and the other from your father, paternal copy. Your cells typically use information from both copies, but in a small number of genes, only one copy is active. Normally, only the maternal copy of the UBE3A gene is active in the brain. Most cases of Angelman syndrome occur when part of the maternal copy is missing or damaged. In a few cases, Angelman syndrome is caused when 2 paternal copies of the gene are inherited, instead of one from each parent. Risk factors. Angelman syndrome is rare. Researchers usually don't know what causes the genetic changes that result in Angelman syndrome. Most people with Angelman syndrome don't have a family history of the disease. Occasionally, Angelman syndrome may be inherited from a parent. A family history of the disease may increase a baby's risk of developing Angelman syndrome. Complications. Complications associated with Angelman syndrome include feeding difficulties. Difficulty coordinating sucking and swallowing may cause feeding problems in infants. Your pediatrician may recommend a high-calorie formula to help your baby gain weight. Hyperactivity. Children with Angelman syndrome often move quickly from one activity to another, have a short attention span, and keep their hands or a toy in their mouths. Hyperactivity often decreases with age, and medication usually isn't necessary. Sleep disorders. People with Angelman syndrome often have abnormal sleep-wake patterns and may require less sleep than most people. Sleep difficulties may improve with age. Medication and behavior therapy may help control sleep disorders. Curvature of the spine, scoliosis. Some people with Angelman syndrome develop an abnormal side-to-side spinal curvature over time. Obesity. Older children with Angelman syndrome tend to have large appetites, which may lead to obesity. Prevention. In rare cases, Angelman syndrome may be passed from an affected parent to a child through defective genes. If you're concerned about a family history of Angelman syndrome, or if you already have a child with the disorder, consider talking to your doctor or a genetic counselor for help planning future pregnancies. Diagnosis. Your child's doctor may suspect Angelman syndrome if your child has developmental delays and other signs and symptoms of the disorder, such as problems with movement and balance, a small head size, flatness in the back of the head, and frequent laughter. Tests. A definitive diagnosis can almost always be made through a blood test. This genetic testing can identify abnormalities in your child's chromosomes that indicate Angelman syndrome. A combination of genetic tests can reveal the chromosome defects related to Angelman syndrome. These tests may review parental DNA pattern. This test, known as a DNA methylation test, screens for 3 of the 4 known genetic abnormalities that cause Angelman syndrome. Missing chromosomes. A chromosomal microarray (CMA) can show if portions of chromosomes are missing. Gene mutation. Rarely, Angelman syndrome may occur when a person's maternal copy of the UBE3A gene is active, but mutated. If results from a DNA methylation test are normal, your child's doctor may order a UBE3A gene sequencing test to look for a maternal mutation. Treatment: there's no cure for Angelman syndrome. Research is focusing on targeting specific genes for treatment. Current treatment focuses on managing the medical and developmental issues. A multidisciplinary team of healthcare professionals will likely work with you to manage your child's condition. Depending on your child's signs and symptoms, treatment for Angelman syndrome may involve anti-seizure medication to control seizures, physical therapy to help with walking and movement problems, communication therapy, which may include sign language and picture communication, behavior therapy to help overcome hyperactivity and a short attention span and to aid in development. Thanks for watching. Hope to see you again in more next videos. Please like and share our video. And watch other videos in the channel. Subscribe to our accounts in social media accounts. The links in the description below. Each